Welcome to the Adapting Chronic Pain Self-Management to the Workplace webinar. This is the 11th webinar in our Return to Work, Stay at Work series. We're glad you're here. My name is Tanya Hyde, and I'll be moderating the webinar today. I'm the project manager with the Canadian Institute for the Relief of Pain and Disability, and this webinar is made possible through the support of the Direct Access Program through the BC government. As mentioned, my name is Tanya, and I'll be moderating the session. And Lisa Mighton, our education coordinator, is also on the line, and she'll be handling the question and answer session. And our presenter today is Dr. William Shaw. Dr. Shaw is a senior research scientist with the Center for Disability Research at Liberty Mutual Research Institute. His work focuses on improving return-to-work outcomes for work-related musculoskeletal conditions through the integration of clinical and workplace factors. Currently, he's investigating risk factors for delayed recovery from occupational low back pain and examining optimal supervisory practices for responding to workplace injuries. His other studies have focused on patient-provider communication of workplace concerns and the strategies that workers use to stay on the job while managing recurrent pain. I'm going to hand it over to you. Thank you very much, Dr. Shaw.
Thank you, Tonya, and thank you for those of you who are taking time out this afternoon to attend the webinar. My topic is to try to address the problem of workers with chronic pain and other chronic medical conditions, and specifically looking at the issue of whether we can take principles of pain self-management that have been used in other domains and apply it to the kinds of problems that people might have in the workplace. So the agenda for my presentation is to provide some data about the prevalence of this problem in the workplace, the issue of presenteeism, trying to understand what the implications are for individual workers who have chronic pain, and then to look at pain self-management principles, looking at some previous interventions and how some of those elements might be something that we can adapt to deal with some of the problems in the workplace. And lastly, to address some of the organizational factors and support that might be important in this as well. And later in my presentation, I'm going to be presenting some data from some previous and ongoing research that we've done here at the Institute, and I just wanted to recognize that a number of collaborators and colleagues have participated in that work and contributed as well. So just for a few statistics to start us off, this is information that comes from the Cornell University Employment and Disability Institute. This is a statistic that in North America that we're all very familiar with. In 1950, 1 in 6 workers was over the age of 55. In 2010, that's 1 in 5, and by 2030, that's likely to be 1 in 4. And this has some obvious implications for employers and for workers who are working later in life, and there are more of them in the workplace. Another problem with having an aging workforce is that older workers are more likely to be disabled. So this is sort of a survival curve from the Employment and Disability Institute. This shows the prevalence of disability or the inability to do your job at different age groups. So you can see that if you're 60 years old, the prevalence of disability in that age group is about 20%, and it's only about 10% if you're age 40. So the risk of being disabled from your work doubles from the age of 40 to 60. So this is, as the workforce ages, one thing that employers and workers are going to face is more difficulty in doing their jobs. Another trend that is interesting to note is that back in 1961, if you looked at the leading causes of disability, it was really things that we could easily measure. It was the cognitive deficits from stroke and physical impairments. We had things that we could pretty easily measure as impairments, and the impacts of those disabilities and limitations were pretty obvious when it came to the workplace. What's really changed is that now we've done a pretty good job of controlling the symptoms and the trauma of some of those kinds of disorders, and now the things that really are keeping people from being able to work are more things like depression and low back pain. So those are now the leading causes. And this is, of course, it's very subjective symptoms. It's very difficult to be measured in some cases. And trying to understand the impacts of these symptoms on work performance can be very difficult. So that's another important change that's occurring in the workforce today. There have been some estimates or some efforts to try to estimate the number of workers who have chronic conditions that might impair their ability to work. And this is some statistics from a study by Wayne Burton and colleagues. And basically it shows that about 20% of workers, or about 1 in 5, has at least 2 chronic conditions. And this didn't include mental health conditions. So it's not an insignificant problem in the workforce even today. Also, there's a real advancing trend with each 10-year administration of the National Health Interview Survey for more and more workers to report chronic physical health conditions. And these are data for males and females showing that even just between 2000 and 2010, the percentage of workers who report 2 or more chronic physical health conditions is really on the rise. So this is something that, in addition to having older workers and having issues of obesity and things like that, we also just have more chronic health conditions. If you want to know what some of those chronic health conditions are, here's some data from, I think, Statistics Canada that reports on the types of conditions that result in the greatest amount of disability, and these percentages on this chart are percentages of the total, or 100%. And you can see that back pain is one of the leading causes. In fact, 3 of the 5 top causes of disability here are all pain-related. Migraine, headaches, arthritis, and back pain. So pain is really a very important issue in the ability of people to work who have medical conditions. Presenteeism is a term that's used a lot to try to define the kinds of problems that workers face in continuing to work while they have a health condition. In the human resources literature, this is sometimes the term presenteeism is used to really refer to just somebody coming to work sick. But in the research on this that uses this topic, it's really referring to a much more global construct of just people being unable to perform their job at the level and the quality that they would like based on health limitations. A number of measures have been developed to try to assess this in research studies. One of those is the Stanford Presenteeism scale that's been reduced to a 6-item small measure, and that's been used in a number of studies. And a sample item from that scale is at work, I was able to focus on achieving my goals despite my health problem. And another scale that's a little bit larger is the work limitations questionnaire, and a sample item from that is how much of the time did your physical health or emotional problems make it difficult for you to get going easily at the beginning of the workday. So these are just examples of some of the items from these scales. So there have been efforts to try to quantify what level of limitation is experienced by people with different chronic health conditions. And using scales like that, a number of studies have really tried to quantify, especially for employers, the kinds of costs they might be experiencing with workers who aren't quite feeling their best and unable to perform at the level that they'd like. This is in US dollars. These are estimates of the cost per person in your workforce who has annual cost who has something, a chronic health condition. And you can see that depression here is the very highest indication. And that the light blue bars here for each one of these conditions represents the cost of just work absence or absenteeism. The dark blue represents the cost of presenteeism. So one important thing to take away from this is that the cost to employers of poor health among their workforce is really more about limitations in their ability to get the job done, not so much about sickness, absence, and disability. So that's just kind of the tip of the iceberg in terms of employer costs. And you can see that the presenteeism costs are anywhere from 10 to 20 times what the actual lost work time costs are. Another study that I've seen that is particularly compelling, I thought, so in addition to not being able to make as many widgets or be as productive as you can, this kind of problem also has implications for workers in their career development. This is a study where Ron Kessler and colleagues went and worked with a number of employers and surveyed their workforce using a health limitation measure, and they categorized workers as either low, medium, or high health interference in their jobs. And they also asked workers to provide their permission for the company to give the researchers their latest supervisor performance ratings. And what they found was I thought, pretty compelling, that your chance of having a high supervisor rating if you were someone who reported high health interference with your job was only 20% as likely as someone who reported low interference. And in terms of low supervisor ratings, you were 4 times more likely to get a low supervisor rating if you reported high health interference. So health not only reduces the ability of workers to get things done, but it also has implications in terms of their career development and advancement as well. I'm going to turn to actually some studies that we've done to try to not just quantify the effects of presenteeism, but we've actually gone to workers with these conditions and asked them, what is it that is a problem for you at work? So the results that are shown here in this slide are the results of some focus groups that we did with workers with various chronic pain and other medical conditions, and we simply asked them, what is it that is difficult for you at work, and what are the things that you need to do to keep on going? And these were some of the really predominant themes in that group. So I'm going to go around this from 12 o'clock, the keeping moving, and kind of go clockwise. One of the things that they all said was that at work it was really important on a bad day when you're having a little bit of discomfort to just keep moving. So if your work that day involved sitting in a chair all day or standing all day, that was a real problem, and that they felt almost like a cat on a hot tin roof on a bad day where they just needed to keep moving from place to place, and as long as they could keep doing that, they would be okay. So moving to the next bubble, they also thought it was really important to keep a check on yourself in terms of having negative self-thoughts about your work and your ability to do your job and just keep on going. The third bubble is they all appreciated the fact that you didn't want to be out in the workforce talking about your pain problem all the time, and there needed to be some judicious use of communication in the workforce to get things done because that could lead to some conflicts with peers. The fourth bubble, finding leeway, what a lot of people talked about was the importance of their efforts to just adjust the way they did their work in whatever ways were allowable in their particular work setting and taking full advantage of those kinds of things. The fifth bubble, being prepared for a bad day. Everyone seemed to have like a little kit of things that made them feel better on a bad day, whether it was fuzzy slippers that you kept under your desk or maybe some aspirin and other medications that might make you feel a little bit better. People had kind of a self-care kit often in their desks to try to deal with a bad day. And the last one is just knowing your work setting. So everybody said, well, it really depends on what your workplace is like. In some work sites, it would be perfectly appropriate to ask for help and ask for adjustments to your work. In other cases, it's not. And so knowing what the rules are is very important. And the types of problems that they reported, just in summary, one of the problems was just pain interfering with work, of course. Another problem was negative self-perception, so just feeling bad about yourself as a worker and doubting your abilities. The third was interpersonal challenges, so that having chronic pain, it was something that kind of made you grouchy at work and often led to conflicts with your peers. And lastly, just the inflexibility of work. So whereas you can manage a problem like this at home in certain ways, at work you really just don't have the flexibility to do that. And so that's something that's very unique about the workplace and presents some real challenges for people who are facing this problem. So I'm going to turn my attention in the next few slides to trying to be a little bit more practical. So you can't really help a worker with chronic pain or other chronic conditions with their work if you don't first find out whether it's a problem for them. So if you're a provider or a rehabilitation professional and you want to sort of find out what's going on with a particular person, these might be the kinds of questions that you would ask. First of all, do you have any concerns about maintaining your current work schedule? So this just opens up the conversation about work and allows somebody to tell you whether they perceive any problem at all. A second question might be which work activities or job tasks are affected, and so this begins the process of problem solving and trying to identify if the worker perceives that there are any real problems or any really particular problems that they're having difficulty with at work, and it gives you something to talk about in more detail. The third question is what are some ways you can vary or adjust your work to be more comfortable? So a question like this is to try to make people begin to be aware that maybe they can make some changes in general in the workplace, we tend to be pretty routinized in the way that we do our work, and we don't often make changes. But for somebody with chronic pain, having some ability to modify the way you do your work is very important. And so beginning to get people to think about, is there some way that things could be different, is very important. The fourth question that I would ask is, what kind of support and assistance do you receive from supervisors and coworkers? And this would give you some idea about the organization that the person works for and what level of help they're likely to get day to day. The fifth question is, do you have a plan for dealing with any health-related challenges or flare-ups at work? So again, trying to get people to think about, how can I anticipate problems? How can I be prepared for them when they happen, rather than feeling kind of blown in the wind by your symptoms and by your job responsibilities, and trying to be as responsible as you can about doing what you can. So this is a very busy slide, but I wanted to make it perfectly clear what we mean about pain and illness self-management programs. This is a body of research that's been around probably since the 1970s. The idea has been to create psychoeducational programs and interventions that are grounded in cognitive behavioral therapy that use coping skills as the predominant method of change, that uses everyday language and understandable to lay persons. And so the focus here is really these kinds of interventions are not focused on trying to reduce symptoms per se, but actually trying to improve function. They often include elements of group participation and peer support. If the groups can actually be led by a person with pain, that's better than having a physician do it or somebody or other provider. So if it can be lay-led, that's especially important. The idea is that you take some basic concepts and tailor them to your individual needs. So this is not a one-size-fits-all kind of intervention. It emphasizes patient empowerment and responsibility, focuses on less severe symptoms. So this is not a way to treat to get medical care. This is really a way to deal with chronic recurring symptoms that have not gotten better, and you are now facing the problem of having to cope with that. And there have been a number of systematic reviews that have really shown that these types of interventions can be very helpful to people who are suffering from chronic conditions. However, none of that has really focused on workplace function or the ability to cope in the workplace. So what we set out to do, our research group, was to look at all of the existing pain self-management programs and try to assess what sorts of elements might be useful in a workplace-focused program. We found 8 programs that we thought were both evidence-based, so we could actually find research literature supporting their efficacy, and also these were programs that are very easily available, so they've been made into books and programs and slides that anyone can find or purchase. And we took a look at the content of these programs, and what we were trying to do was, first of all, categorize all the principal elements of these programs, and then take a look at their potential application to the workplace. And what we found were 24 distinct training elements among all of these programs, and we divided them into things that we thought were particularly relevant to the workplace and things that might not be so relevant to the workplace, or at least would be things that it would be tough to sell to an employer in terms of workplace self-management. So the things that you see in the top here, about 2/3 of these elements were things we thought could be relevant to the workplace and could be adapted to workplace problems. The things below the line are things that we thought might be not so relevant. So, for example, communicating with physicians and intimacy, nutrition, some things that we thought didn't have quite as much relevance to the workplace. And you can see the things that are highlighted in red on the top here are things that sort of jumped out at us. These really sound like something you might do in the workplace. So, for example, thinking about body posture and ergonomics, thinking about time-based pacing, those seem to be things that really seem well suited to workplace activities. We did, however, also note that there were some things that were kind of missing from those programs, or at least some perspectives about the workplace that would need to be integrated into this kind of a program if it were to be focused just on workplace issues. The first is that there's this whole issue of physical demands that we might not have at home, and how to overcome some of those if your work actually involves some physical work or postural challenges that you don't have at home. The second area that is really unique to the workplace is this issue of job leeway. So, at home you can probably make a lot of decisions for yourself about exactly how you do something, how you might pick something up off the floor, for example, or how you schedule your time at home. But in the workplace, you don't have that same level of freedom. And so there's this issue of what your job really allows you to do in terms of adjustment. And that's really critical when it comes to the workplace. The third area is really understanding the roles that people play in the workplace is a social environment to some extent, and usually you're working with people, and you really need to understand your roles and relationships with those people in order to make good decisions for yourself about how to, for example, obtain support in the workplace. So we took that information and actually developed a program, and we're in the process of testing this in a randomized trial right now, but I wanted to tell you a little bit more about this intervention program. It's 10 hours in total. It's 5 2-hour sessions. We've kind of modeled the format of this training after the existing pain self-management programs. The content is divided into 5 sessions. The first one's just to orient people to principles of self-management, to get them kind of on board with the idea that they might have some ability to control pain and their responses to pain and the way they do their work. The second one's really focused on these physical aspects of work and how people might be able to overcome problems with function that may surface at the workplace. The third one is about communicating health problems at work and making the right decisions about who you talk to, when, and what you might say in order to get the type of support and assistance you need at work. The fourth one is just really the issue of emotional fallout of this problem and trying to keep a positive outlook, using some cognitive behavioral therapy principles to try not to let this problem get the better of you. And the fifth session is really kind of putting all of these ideas together and what are some things you can do, what are some tools you could use to try to put these things to work in your job. Each session was 2 hours. Each one started out with a check-in. If there was a weekly exercise that was reviewed around the table. There's a didactic presentation by a facilitator, and then a group discussion about that topic, some in-session exercises, and lastly an assignment of a weekly exercise. And we actually have tried to also implement some social support by having people telephone call each other between sessions to trade information about the content. So we're in the process of testing this out. We've done at least one pilot group through this, and they seem to like it a lot. We also have kind of a conceptual model behind what we're doing. I think maybe there's a lot of information here on this slide, but the point is that we believe that these interventions might be effective to improve workplace productivity and workplace function through self-efficacy. So in order for people to try some new things to help them be more functional, to communicate differently perhaps in the workplace, they really need to feel confident that they have the skills and they have a plan for doing this. And that's really what the intervention is all about. So just a little bit more detail about each one of the sessions. In the first session, we're really just trying to give people a psychosocial orientation to pain and medical conditions, not to take anything away from them about the seriousness of their problem, but rather to try to suggest that the way they think about their problem, the way they behave about their problem, the things they do at work can both influence their pain and influence their ability to cope with pain. And really that's the first, and to establish rapport within the group as well. The second session is really uses problem solving as the primary element of trying to make changes. So rather than just kind of charging ahead, we would suggest that people really think about the nature of problems they're having at work, analyze those problems, and try to generate some potential solutions in the workplace. And the problem solve. So this is a problem-solving process or wheel that's used in a lot of management training, so that we thought this was very consistent with the way people think about solving workplace problems. And it's a wheel, so sometimes it doesn't work and you have to start over at the beginning and go around again. So we use this as sort of how you actually make changes in your work, especially if it involves other people. And the third session is about communication, and I think the key here is to for people to recognize that the reasons for communicating about your pain or health problem could be very different. So in one case you could be really looking for just empathy and support and validation, and that might be something that would come from a worker that you have a very close relationship and rapport with. In other cases you may just need help to lift something across the room, and the way you would communicate about your problem would be really different in that case. You don't need to give someone a long story. You can just say, hey, can you help me do this? And that might be all they need to know. And the third reason for communicating is this more formal kind of request from the company or from your supervisor for a specific type of accommodation. And of course, you'd have to think that communication out very well before you would make that request. And so a lot of the training in this session is to sort all of that out and understand, why is it that you might talk about this problem at work, and what are the right and wrong ways to probably do that. In this session 4, we really just use the same kinds of principles that are used in depression counseling to think about your thoughts and how it affects your behavior. ABC model is activating events, beliefs or thoughts, and consequences. And what this tries to do is have people appreciate that the thoughts, the automatic thoughts that might run through your head when you have a problem doing something at work because of your health can really ruin your day. And so really catching yourself with these automatic thoughts and trying to replace them with more realistic and less irrational beliefs might lead you to having a better day at work. Session 5, this again was just trying to bring a couple different ideas together to talk about some of the things that might not actually be in the workplace but might have an impact on workplace. For example, exercising and stretching and sleep hygiene and things like that. And we talked quite a bit about time-based pacing. So the really typical problem in chronic pain is that you have a great day where you're feeling terrific and you go out and you garden and you do all these things, and the next day you're on your back in bed because you feel so miserable. And trying to alleviate that kind of cycle is a really important thing, both at home and at work as well. So up till now I've been talking about what we might ask workers to do, but I think it's important to recognize that not all employers are going to be very open to the flexibility and adjustment that workers might think they need to be more functional at work. So the employer is certainly a stakeholder in all of this. We have a whole other line of research kind of focusing on what supervisors and employers do and how they respond to workers who might bring this problem to this kind of a problem to their attention. But this is certainly a big issue. So we tend to think of employer accommodations in a very formal way. So we know that there's in most countries there's a legal requirement that employers provide reasonable accommodations to people with disabilities. We tend to think about things like raising desk heights or giving new chairs and things like that, really physical ergonomic adjustments, but there are many others as well. But I think from the workers that we've talked to with these kinds of conditions, it's fairly rare that they would actually have a formal accommodation arrangement with their employer. What's far more likely is that they've just found all sorts of ways to alter their work on their own, and at least until somebody tells them they can't do it that way. So there's really a lot of self-empowerment and a lot of self-management that goes on every day with these kinds of problems, and it's not something that gets entered into an HR file or is on the records with the employer, but it could be a very important factor that allows somebody to keep on working or be as productive as possible if they have a health condition. So I wanted to talk a little bit about employer factors, and really the research has not come far enough to give you a lot of information about this, but I'm going to refer to a panel that I was on a few years back where we were looking at back pain and the kinds of workplace factors that from the literature evidence suggested that these were sort of disabling organizational factors, especially for back pain. So I'm going to use the results of that review to talk about workplace factors that might be important in this. So we identified 7 workplace factors where there was a reasonable amount of evidence that's supporting the fact that if your job is like this, you're more likely to, or you're more likely to have more difficulty coping with the problem at work. One of those is heavy physical demands. So, of course, if your job is very physically demanding and you have chronic pain, that is going to be a bigger problem for you. It's especially interesting in the literature to see that this is really workers' self-reported physical demands that is very predictive of disability. If we actually went out with some ergonomic tools and tried to measure forces and things in the workplace, that may actually not predict disability outcomes. So it's really important to get this kind of information directly from workers. Another kind of problem that a worker might face in their organization is just having a job that is really difficult to modify in any way. So if you're a school bus driver and there's public safety concerns and you have a lot of children in the back of the bus, it might be difficult to pull your bus over on the side and stand up and stretch. So if your job really doesn't allow you the flexibility to do these kinds of things, that can be a problem as well. And of course, if your workplace is not a supportive one, where you really don't have any good close relationships with peers, and you may have a history of conflicts with other workers, that's a factor that contributes to disability as well. So if you don't get along real well with the people around you, and now you're looking to them to help you through a difficult time, that's not easy to do. The fourth one is job stress. So you can imagine that if you have a job that's extremely competitive and has a lot of time pressures, where there's maybe not any real wiggle room in your schedule at all, those are the kind of jobs that would also be difficult for somebody to manage chronic pain with, because they if they blink, they're replaced with someone else perhaps, or just the pace of work is just not tolerable for someone with chronic pain. The fifth one's job dissatisfaction. So if somebody has a job that is just boring and not very motivating, it may be a job they've been in for a long time and they just don't feel that it's rewarding at all, they're not going to spend too much time trying to manage a problem at work if it's a job you really don't want to have in the first place. The sixth factor that seems to come out from the literature is just an expectation that anything that you do in the workplace will not work. So and that tends to be a self-fulfilling prophecy. So if people think that, well, it's no sense doing anything in the workplace because nothing ever works, it probably will. It probably won't. And the last one, the seventh factor, organizational factor that seems to make people more disabled, is a fear that resuming some of your normal job activities will actually lead to a more serious condition. So for somebody with chronic pain, they have good days and bad days, but they also can have a real fear that I could get much, much worse and it would have a much greater impact on my life. And so sometimes managing the physical demands of a job can be difficult if you think that, with every step you take, you might actually risk a much more serious life-changing event. So in conclusion, I just would like to say that workers with chronic pain face significant challenges in the workplace. It's a growing problem, and it's a problem that both workers and their employers will need to grapple with in the future, and that it looks like many of the pain self-management principles that have come from evidence-based treatment strategies from the psychology literature can be adapted to address workplace concerns. It looks like organizational support and job characteristics are a very important moderating factor that we need to consider. And lastly, that individual and organizational interventions look helpful, but we really need to do more work to study both their cost effectiveness and their feasibility in different types of workplaces. So the kind of the wild card here is, with what kinds of jobs and with what types of employers is this sort of intervention really likely to have good outcome. And I should mention just in closing that we are looking for employers to participate in our trial, and so if you are working with or in an employer where something like this might be interesting to try, for example, at one location or one factory or something like that, please don't hesitate to contact me. So my email is shown on this slide. And I think with that, I'll turn things back to Tonya and Lisa and see if we have any questions.
Great, thank you very much. I just wanted to clarify with your call for employers, would it matter that quite a few of our participants would be Canadian employers if they were to contact you. Would that make a difference for your study versus being an American company?
There are probably some details to be worked out, but I would say that that's not a problem.
Okay. Okay.
We actually have done some previous work where we've had sites in the U.S. and Canada as well.
Okay. Wonderful. Just wanted to clarify to make sure. And then at this point, it doesn't look like we have any questions right off the bat. So if you have questions, those who are online, feel free to submit them through the questions box. And I did also want to address one item. Someone did ask about slide presentation, the slides being available, and we will be posting those as well as the video probably early next week, and that will be included in the email you get. Lisa, do you want to go ahead and do questions?
Sure. Somebody has just posted asking, do you feel that this training for the employee in pain would be well suited for EAP providers?
That's a great question, and actually when we first set out to try to pilot this intervention, we had some employers who were interested, and we ran into an awful lot of problems, feasibility problems, in trying to have it administered directly through the employer. Employers are very concerned about privacy issues and the potential problems with kind of asking workers to participate in a program that would kind of brand them as somebody with a chronic health problem. So what we've done actually is to work through employee assistance programs. So EAP, and this is something a tool that most employers have. I don't know how different it is in Canada than in the U.S., but most large employers have an EAP provider service that deals with all sorts of behavioral problems in the workforce. It could be issues of conflict. It could be issues of substance abuse. It could be issues of emotional distress. And we found that those people are really in the perfect spot to host a study like this. So we've actually are training EAP providers to be the facilitators at the groups and allow employees to sign up through their EAP programs. Did I answer that question, Lisa?
Yes, I think so.
Oh, there's one more here. They're saying, and you can let us know if this is appropriate, how can we direct our EAP to you if interested? Do you maybe want to send us that information after, and we can include it in what we email out?
Yeah, well, we have a research trial, and we have brief flyers and information sheets about that, and so that would be the way to start probably. We've actually, the more we get involved in this, we see the real opportunity for EAP vendors and consultants to really kind of champion this idea. So we hope that in future, for example, in the U.S. there's an EAP association, and we hope to present some of our findings at their annual conference, because we think that if we want to actually implement a program like this, maybe the best way to disseminate it would be through existing vendors that employers have, and that would be EAP providers.
Okay, a few more. How would you approach an employer about improving the workplace with respect to making it chronic pain friendly, as many would perceive the topic as just a source of expense?
Yes, so this certainly is not the program that every employer is ready to roll out. So I think this is the kind of program that only works when workers have a sense that there's a general good safety and wellness culture within the organization, that they have some level of trust with their employer, and also that it really can't be too much of a sweatshop, because it really doesn't make any sense to workers if the employer's offering help with a problem like this, but then through one side of their mouth and then through the other side of their mouth they're really creating some really extreme demands that they are unable to meet. So I think in the research we're doing right now, we're really just focusing on workers, but we do recognize that this is a two-way street, and that really the right way to do this outside of a research context would be to do both. So for example, have a training program that's available to workers, but also have a training program for supervisors so that when a worker brings a problem to them, they actually feel like they have better skills for dealing with it and will say the right things and be able to provide support in a way that their employer approves of. We've gotten really different responses from talking with employers. Some will say, well, my workers, I don't want to know anything about their health. That's their problem. That's a privacy issue. I don't want to step over that line. And then others say, well, yeah, we have a depression screening program. We have an internet-based wellness program. We do diet and exercise. Like, that actually is really in keeping with other programs that they have. So I think that the best way to look at readiness for an employer is to look for those kinds of things. I think that the other part of this question was about how do you sell it to employers, and I think we've had most luck with costs, of course, because that's something that matters a lot, but also headaches. So a lot of employers don't. This is an area where the supervisors really don't get training in. It could be a growing problem of health and chronic health conditions among their workforce, and there is no real existing way to deal with that problem that's very systematic. So what we're trying to say is, here's a problem that you face in your workforce that you really don't have a solution to right now, and that seems to be a compelling argument as well.
You mentioned that you're in testing right now. Do you have any sense of when you're going to, or a ballpark on when you're going to roll it out? We have some questions about how do we bring this approach to the Canadian marketplace. Is it a reproducible product yet?
We have employers that we're partnering with now and actually doing this randomized trial. There's nothing proprietary about what we're doing at this point, so I can double check, but I think everything that we have in terms of materials is freely available to anyone for the asking. So it is experimental, so it's not something that's been proven effective, but we would certainly love to see people giving it a try if the environment they're working in is right, and if there's a way to do it that's feasible.
Okay, I think that's all the questions that we have in at the moment.
Okay, great. Thank you very much, Bill, for that presentation. I think that was incredibly helpful, and I think it could very much prove to be a really incredible tool for helping people to manage chronic pain at work, but also helping workplaces to really adjust to recognizing this as something that they can be a participant in as well. So thank you very much for that.
Thank you.
And I think we'll go ahead and end the webinar then. Thank you everyone for joining us. Today, just to let you all know, our next webinar is actually next Wednesday and on October 23rd, and it's with Dr. Sharon Switzer McIntyre, and she'll be discussing occupational disease and return to work strategies for success. So there's probably going to be some correlations between that as well as with this presentation. So we hope you'll join us for that. And thank you everyone for being here, and we look forward to seeing you next time.